Hey, it's now time for Ask the Doc with Dr. William Whaley, brought to us by the Georgia Cancer Research Center, affiliated with Northside Hospital. Again, we're at Circuit World here in Blue Ridge. I'm your host, BKP. Dr. Whaley, thank you very much.
How you doing?
We made a deal.
You're well now?
Well, yes, I'm well. I feel fine. I actually feel great. Just didn't get home till midnight and a little after midnight before I got in bed. So we made a little deal. The audience must know you're going to help. You're going to pull me through this one, right?
Yeah, I am. He doesn't have his computer. I got big words in the questions. Now, you didn't ask me about my tie.
We haven't gotten there.
Oh, okay. Go ahead.
How about that tie?
Okay. Now, I wear this tie. I wear this tie on Veterans Day and the 4th of July, and when Mr. Trump goes to Afghanistan. I'm wearing this tie today for my nephew, Brant Hamilton Whaley, who's sitting over here in the audience watching what we're doing. He's an Afghan veteran, and he's here visiting with us a couple of days. And if it works out and the rain lets up, then he's going to go shooting today with one of your all-star panel and maybe one of the sheriffs out at the skeet range and teach his Aunt Jane how to shoot. So we're here. They're wearing this tie for Brant today.
Yeah, wait a minute. I'm good with all that, and I'm glad to have you here this morning. But the one part in there, what do you mean teach Aunt Jane how to shoot? I don't think that's necessary.
No, I shouldn't have said that.
Yeah,
She's supposed to be good.
Yeah, I was getting ready to say I don't think you're doing that.
I guarantee you, she'll compete. She might not win.
That's what I was getting ready to say.
She'll compete but not win. All right. Now the second thing, when you're talking about the rain, I still want everybody to remember, as I said 2 weeks ago, in 2018 we were 17 inches up. In 2017 we were 13 inches up. But in the prior 3 years, when you were having to dig your well deeper, we were about 30 inches short. So we got to have another extra 4 or 5 inches this year. So don't complain about the rain. Oh no! Wait a minute! I got to begin. Got that poster up there?
Oh, okay, sure.
You'll remember.
Yes.
This is the 17th year. Get that thing up there big. All right. This is the 17th year of the Georgia Cancer Specialist Northside Hospital Totes for Tots. This program began 17 years ago when one of our employees who took in foster children, the foster kids showed up at the home with their clothes in plastic garbage bags. Remember, they didn't, and it was an emotionally devastating and kind of degrading experience to move from one foster home to the other and not even have something to put your clothes in. And then they set them up for school, and the school bus came to pick them up, and the kids had to put their school books in a grocery sack, and all the other kids on the bus had backpacks. So 17 years ago, in a couple of our offices, they had this thing, Totes for Tots, and if you pay attention, you'll see this all over. It's 40 offices all over Georgia. And this is sponsored by Channel 2, but it's all in Georgia Cancer Specialists. So the Georgia Cancer Specialist office in Blue Ridge, which is here at Riverstone, in Blairsville, which is at the Cancer Center in Blairsville, will accept your suitcases or backpacks to be given to foster children to carry their clothes in and their school books in, and it'll stay in Union, Gilmer, Fannin County. They're not sending it to Atlanta. And we'll be collecting from today. It was Martin Luther King Day is the way this all began. We'll collect from this morning through the end of the week next Friday. So Riverstone, 102, Georgia Cancer Specialists, or Blairsville at the Cancer Center. If you go look around in the basement, your kids have gone off to college, you got 4 or 5 backpacks down there and some suitcases, gather them up and take them to the...
All right, so this starts today.
Goes till next Friday night.
And it goes next Friday. I want to make sure you send that to us and let us help with the the week, because I want to make sure I know everywhere they can drop off.
Good.
Because I tell you what, these kids in foster care system, they don't know when they're moving.
No, and we've gone through this before.
Yeah,
it's a sad thing to be in foster care. Well, Josh has already got
You've already got that graphic. Okay,
all right.
And we'll be telling you folks more about this. We're going to put it on. You can find this graphic on how to get involved, and we'll put some notes on to help this great cause. And you can find that on Fetch Your News, Facebook page. We'll give you all the details on that. We'll be blasting it out. Thank you very much for bringing that to us.
Big words there now.
We'll see if we can't. We'll push right through, okay? We'll see what we can't do. I remember the doctors saying before we lost my grandmother to breast cancer, she was in her 70s, that they believed that her cancer was capsulated or encapsulated. What exactly does it mean for cancer to be encapsulated? Does this change the genetic risk I'm at?
You did really well. Congratulations.
Good.
All right.
I tell you, I'm going to push right through.
You did good. Show that first graphic. It's this is a histologic picture. I want you to just leave it up there because this is a complicated question. One, they lost their grandmother to breast cancer. That's the first part. And second, a surgeon told them when they came out of the operating room that the tumor was encapsulated. Well, basically, when you have a hunk of meat that you took out at surgery, you haven't got the foggiest idea what it's going to look like under the microscope. So if you look at this, the one on the left that has the nice fine line there is under a microscope encapsulated because it's all tight. You see that?
Mm-hmm.
The one that's right beside it is invasive. You see how the stuff goes out into the rest of the normal tissue up here? The dark is the cancer. Well, you can't tell that by looking at what you got at surgery. So when I see this every day, people will come in and say, the surgeon said I got it all. But then when you go looking at the lymph nodes, microscopically, they got disease in 4 or 5 lymph nodes. I say, got it all is not the concept here. The concept is this is in your lymph nodes. If you don't do anything else, you have a 95% chance of recurring. So just one thing about real encapsulated histologic microscopic breast cancer is, now I'm not going to make you read this word, but it says this has indolent behavior and extremely favorable prognosis. So if this cancer had really been encapsulated, it would be extremely unusual and rare for it to recur. And therefore, the surgeon saying that it may be encapsulated is not proof that it's encapsulated if it's not histologic. You got that? So if it were really encapsulated, it would not have required any additional treatment. It would not have recurred. They would not have lost their grandmother. Okay, you got that part?
I'm staying with you.
Okay, now, the second part of the question. So go to the next part of the question. Second part of the question is, well, what does that mean to be encapsulated? I just told you. Does this change the genetic risk that I'm at? Well, first of all, that's not that I'm at. We never end a sentence with a preposition. It should say, does that change my genetic risk? But your all-star panel would not like the way that was written. So you got the next thing. Show it up there. These are cancer risk factors that you cannot change. So that these don't. So it's not like too much alcohol, obesity, taking birth control pills, hormones, any of the rest of the things that we know can increase your risk of cancer that are not genetically related. So age is a factor, race is a factor, family history is a factor. You can't change any of those. So the fact that your grandmother had that, there's nothing you're going to do about that. Your personal health history, that has to do with the weight and the alcohol we talked about before. You can't, the fact that you have early menstrual periods or late ones or late menopause, again, are factors that you can't change. So the question is, no, it does not change your risk. All right, you will go to the next one, Josh. So what this really gets down to is most encapsulated tumors are big because they don't cause any manifestation that a patient could have or pick up on when they're in the shower. You know, we always talk about, I found a lump. So this shows you what patients would be looking for to tell them they need to go see the doctor or go have a mammogram. But it doesn't have to all be a lump. You know, it can be changes in the skin, dimpling in the skin. It can be a change in the way the nipple looks. But this encapsulated tumor, by the way the question's asked, I'm interpreting, would have been one that was associated with none of these external things, because a real encapsulated tumor is in a kind of like inside a nut inside a shell, and it doesn't have the chance to pull in the skin or change the character of the skin. Go to the last one, Josh. So this cancer that's as big as 5 centimeters as big as a lemon. I have seen most encapsulated tumors that I've seen in my practice. Now remember, it's only 1% of breast cancer, so it's very uncommon, have all been relatively large, either between about half the size of a lemon or the size of a lemon, and never involving any lymph nodes, because as it says in here, you can take that down, Josh, as it says in that thing I read to you, it is generally not particularly invasive. It doesn't require any additional treatment, meaning it never involves lymph nodes. So I think that the poor family there had misinformation, or they didn't lose the histologic pathologic evaluation didn't confirm what the surgeon thought when he saw it in the operating room. So if it's histologically encapsulated and they tell you that in your final path report, that's a good prognostic sign. If they thought it was encapsulated but it wasn't, all bets are off.
Well, I appreciate that. That was very well detailed and explained, and I think that was probably very, very helpful
I wasn't building a watch by telling you what
No.
Right.
I think that was, well, the only way I know how to put it, I think that was the only way to really explain this question is every bit of that. That was very, very interesting. And I know our audience appreciated that, and they appreciate you answering these questions every week. And we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for that question. And our next question, I noticed over the last month or so that when I stand up, a lot of times I see black spots in front of my eyes for like 10 seconds. What could make this happen? Is something wrong with my eyes or my brain? Well, I mean, why make me read that? Something wrong with my brain. But I don't want to make light of that, because...
No, it's not light at all. We get complaints about this all the time. We have 2 members of the All-Star panel sitting over there at that table. I guarantee you that both of them have had what we call floaters, all right? Mm-hmm. So we're going to get Josh to put up, it's going to take up most of the screen, and he's going to pull up kind of you got the first one to say, why do I have floaters in both eyes? All right, just stick that in the corner of the screen. And the etiology of floaters is, I hate to say this, how's that begin? As you age? Oh my goodness. So as you age, the jelly-like part of your eye, which is called vitreous, begins to sort of dissolve and become more liquid, and other parts can kind of congeal and become a little harder, so that they kind of form these little fiber-looking things that look like a hair, and those things can float around in your vision. And Josh is going to show one of those in just a minute. And those can occur when you're standing up and just moving, when you're sitting, standing, lying, or anything else, and just moving your eyes. Now, this question began with, when I stand up, right?
Yeah, that's what.
Okay. Now,
a lot of times I see black spots
now, the one
in front of my eye for like 10 seconds.
Okay, what I just mentioned there was, it looks like a hair. They saw black spots. So the ones that's showing up now, my eyes are, they're sort of green. Yours is sort of blue and green and everything. Jane's is sort of brown, but they all have pigment, right? Well, the back of the iris begins, once again, as you age, to sort of slough off little bitty scales of that pigment. And they fall down in the waterous part of the eye, and they are sitting at the bottom down here like that. So that when you bend over to tie your shoe, they rise up in your eye because your eye is looking down instead of that way. And then when you raise your head back up like that, they're up here and they sort of settle down. So generally the black floaters that last only for 10 seconds go up to the top and then sort of slowly drift down into the bottom of your eye. Now go to that next one, Josh. Now this next one, these are a little bit harder to show, but he's gonna fill the whole screen with it. So now you're not seeing us, but you're hearing us. But you notice how all these look like these long curly hairs?
Mm-hmm.
Okay, that looks like you got hairs in your eye. Well, that hair in your eye is actually the vitreous humor part that I was talking about earlier, which forms these little squiggly lines. The very first slide we showed you here said, in both eyes. That's the most crucial feature of this. So both
you're putting a lot of these parts together of what's very important in this one sentence.
Exactly right, because I'm getting ready to go somewhere really important.
Right.
Okay, the place we are now.
I am following you on this one.
All right, place we are now. If he's following me and Josh is following me, I'm pretty good here. So the two that I have just described, I guarantee you that probably four or five of us in this room have, in one form or another, to one degree or another, and probably Bruce and Rick may have worse than other people because they're a little older than the others. But anyway, the older we are, the more likely we are to have these. Now, this is the important part. Those are benign and occur with aging. There is a extremely serious condition, retinal detachments, and other things that occur. And if you have these, you don't stay home and say, Dr. Whaley said this is normal. You go immediately to an eye care professional. You do not go to your family doc. One, you've got small amounts of floaters like we've got now, and suddenly you've got tons of floaters. One eye only, okay? Second, if you see flashes of light in the same eye as the floaters, that frequently can mean that the retina is having a tear in it. Or if you see the floaters and then there's associated circle of darkness or something. Now this thing's supposed to be turned off. It's turned off there. If there is a circle of darkness or if there's a shade in your vision, then that means that your retina or the movie screen has been pulled down. So I want to make it clear that those floaters of the 10 seconds, they go and they come down, are totally normal. They occur mostly when you age, but if you have any of these acute things with the circle of vision, the flashing lights, or any of the rest of that, it's an emergency and you got to go see your doctor.
You know, there's several things in there. What if, and I don't want to sidetrack this. What if somebody said that when they stand up, they were seeing something, but it was also had a little dizziness to it?
Okay.
Does that change the whole dynamic?
No, not at all.
Okay.
Not at all. No. The dizziness is, well, if you're taking blood pressure medicines or something, you know, it's
right.
That's your blood pressure falling. But floaters do not cause dizziness.
Okay.
So if you got some dizziness when you stand up and you also see floaters, it's true, and unrelated.
True, and unrelated.
Okay, what's true, and unrelated? College boards. Testing. You kids out there, mamas, make sure they remember true, and related, or true, and unrelated. So when somebody says, I got a flu shot, and then I immediately had a cold, and so I'm not ever taking a flu shot anymore, that's true, and unrelated, because the flu shot can't give you a cold. But as I said before, so many people get these flu-like illnesses. They're sick 2 or 3 days. They got a temperature of 102. That occurs very frequently. So we were talking about a guy who had those symptoms this week. I think he had them on Monday and Tuesday and Wednesday. And if he had a flu shot on Friday, everybody would have said, well, you got that from the flu shot. It would have had nothing to do with the flu shot. And that would be true, and unrelated. You understand what I'm saying? True,
and related?
Unrelated.
True, wait. Yeah. True, and unrelated.
Yeah, true, and related. True, and related is you had 6 drinks and you ran off the road. All right?
Okay.
You got that one?
No, I got it.
All right. And true and unrelated is you chewing and Wrigley spearmint gum and ran off the road.
Got it. That was got it. Georgia Cancer Research Center here, affiliated with Northside Hospital. Okay, our closer of the week, Dr. Whaley, what is out there in the medical world or out there happening today that you want to share with our audience?
I want to share the Totes for Tots again.
Sure, absolutely.
I have more stuff. I mean, I'm not even going to go into it, but it's going to be announced in the paper today or on the news today, the news tomorrow, that those food recalls we had this past year set records. 80-something% of the food recalls that were for meat were associated with products that made people sick and killed them. And it used to be years before when they had food recalls for romaine lettuce or for what was that Aunt Jemima pancake mix. I mean, they recalled billions of doses of stuff, but it didn't make anybody sick. So the big thing is that the food recalls are more serious. You need to be really careful about your chicken and your turkey and all that sort of stuff. But I want to go back to the Totes for Tots. Jane has been on the board of several of the North Georgia organizations that look to battered women and women without children and homelessness and all the rest of that. And the foster kids, we have talked about up here a lot. We have a lot of foster kids in the mountains.
Yes.
And you wouldn't think we do. We have a lot of foster kids in the mountains. There are a lot of community things of their awareness about helping keep them out of trouble, mentoring them and the like. But that part about them not having a backpack and being different from the other kids, you don't want them to be different. You want those foster kids to look like everybody else's kids. You want them to be able to go to school with everybody else's kids. And a backpack, you can get a backpack at Walmart or over here at Rose's for a few bucks. Let that kid get a backpack for his books, and the next time he has to move from one place to another, let's not have him putting his goods in a daggone grocery sack. Get that. We've got, you got 25 suitcases in your basement you don't use anymore.
I want to double back to where we started the show when you first made the comment. I want to double back to, you said this emotionally years ago with your organization here that you're affiliated with. Emotionally years ago, this happened.
17 years.
Right, 17 years ago, and the child showed up with just a plastic bag.
Plastic bag
with clothes in it. And the thing is about foster children out there, folks, and I know you, when you stop to think about it. That plastic bag, they're carrying their whole world.
That's their life, yeah.
Their world's in that bag. When they show up as a foster child, they've been taken out of probably a situation we don't have time to go into. And that world is that plastic bag. And every time they leave, they pack up their world. And most of us that grow up in a home our whole life and don't know anything about that, we don't know what it's like to have our world, our entire existence in a bag. And this means a lot. We want to do what we can to help this week.
You got all week to bring it to Riverstone or to bring it to the Cancer Center in Blairsville. And for those of you down near Jasper, we've got an office in Jasper back behind Rocco's Pub, and they're doing the same thing. You can bring them down there in Jasper today and all next week as well.
That's Totes for Tots. Totes for Tots. It's starting today, all next week, and we will at fetchyournews.com, fyntv.com. We got this already on the screen. We got the graphic. We're going to be pushing it out through social media and giving you the locations where you can help and get involved and help out with Totes for Tots. I appreciate it very much.
Right. So and welcome, Brent.
Yes, glad to have you.
Afghanistan vet.
Glad to have you. Thank you for your service.
Tie for Brent.
I hear a lot of chatter. You hear chatter off.
I think we're running over.
You chatter off in the distance. Yeah. They're ready to go. That means it's the All-Star Political Panel, and they'll be up right after this. And as usual, I don't know if we have anything to talk about, but we're at Circuit World here in Blue Ridge, and I'm your host, BKP. And again, thank you, Georgia Cancer Research Center, affiliated with Northside Hospital. You have a great day spending the rest of the time with your nephew before he goes out of town. And thank you. Appreciate it.